field. So I wanted to talk to you today to expand upon your editorial, to get some sense from both of you of, first of all, why do you think this is taking so long? I know it's a big question or vague question, but what do you think?
Well, I think one of the first things that we need to acknowledge is a lot of people don't consider this an issue. And I think recently with social media and social movements and the pandemic, the COVID-19 pandemic, these issues have come to surface more. And we really need to focus on minorities and underrepresented minorities and women in academia. And I think all of these variables have brought this up to the forefront, where before it was an issue that was in people's minds, but not necessarily anything that was seriously acted upon.
Yeah. And if I may add on that, I think that as Dr. Karzai mentioned, it seems that, to the events that happened, back in 2020 with the incidents of violence, as well as affecting other minority communities, as well as the COVID pandemic. And now we have the knowledge that this is an issue, and we have known about this for years and years. But as Dr. Karzai said, this is something that we kind of failed to acknowledge. And that's why I think at this point is like, now we know this is here, we acknowledge, so we need to find the solution on how we can improve it. And I think that I agree, I feel like there should be some, in my opinion, and Dr. Karzai, please feel free to comment more, but I feel that in order to make changes, I think that there has to be, programs or workforce place in every institutions, and make us accountable for everything that's going on as well. So that way we can make the changes. I think that expand these programs onto diversity, inclusion, equity in every institution is important, that needs to be implemented. Sometimes one of the setbacks is about having the necessary resources to do that. And that's something that we also discuss in our editorial, but that's something that we definitely need to discuss, how we can amplify these resources so that we can make the changes. On the other hand, I think that all these programs are really necessary in terms of kind of having this equity and inclusion programs as well, and make sure that even leadership who is from front of all this, that also, as I say, held accountable that everything is going on, and also transparency. I think once we know that there is transparency, that there is a changes, we then feel like, okay, in a sense that we have a responsibility to make those changes.
I see. Excellent. So let me ask another question as a follow-up. So what in the immediate future do you think, if anything, institutions can do to counter affect the negative impact that the pandemic has had on women and minorities, particularly in the medical profession?
First, I think that there needs to be programs that actually make sure that women and minorities are implement or have the opportunity to become part of leadership in other types of high profile jobs, in order for us to be able to see them on a level that maybe is not present in medicine currently. The other thing is providing some kind of support for women and underrepresented minorities during these times, to be able to publish, to be able to have some type of availability or extra time for tenure, for promotion. There has to be some type of a timeline that's extended, and be given more opportunities to be able to expand their careers. A lot of what we have written about and what we've noticed is that women and underrepresented minorities have many roles, and many of those roles include in the home and in academic institutions. And so there really is a paucity of time. We need to address these kind of issues and other social issues too, like childcare and things that would help all men and women go forward in their careers.
Mm-hmm. Yeah, I completely agree. And I think, if I may add also something there, is about just expanding on what Dr. Karzai just mentioned, and is also mentioned in the editorial as well, it seems that even during the pandemic, a lot of the household responsibilities fell into women. And I think that that was very stressful, and I feel like that definitely impacted all women's and minorities, but all women's in general who wanted to pursue a career in science. I think during that time, it was very stressful to take care of all the household responsibilities. And I think, as Dr. Karzai mentioned earlier, having programs implemented for those situations, I think it will be important as well. And also, like, if I think one of the other issues that we discussed as well in the editorial is about the women's and minorities. Also, it seems that in terms of having grants, successful grants, and extending those grants, I think is something that we need to put a lot of more attention, so that way we can make our women more successful in career and science, based on all the other responsibilities that they're dealing with. But I think having a program, education is very important, and having a program that can help in those situations, or how is very important. I think that also has to be at the level of the leadership as well, and also mentorship. And I think that's something that we have discussed as well in the editorial. And having also certain programs or courses that we can always take as well in terms of the leadership, that is also leading for different women's in different backgrounds. I think that's kind of like where a change needs to start as well, and we need to see more of that.
Okay, terrific. And just following up on that, would either of you or both of you care to comment on what types of changes do you see being implemented, for instance, at the NIH? If you don't want, okay.
So at the NIH, there's two levels. We've seen NIH-wide initiatives, and Dr. Del Rivero and I are in the National Cancer Institute, and we have seen initiatives in the National Cancer Institute too. They include trying to expand minorities and women in roles, leadership roles, in trying to combat structural racism, and trying to identify the areas in which we are weak, and trying to find ways to implement greater diversity, both into the workforce and into the type of trials, clinical trials that we do. There's a lot of initiatives going on, but I think we still have a ways to go.
Yeah. Yes, and yes, you're absolutely correct. And I think that that's our institution are very, very eager and very motivated to kind of like end structural racism. And that's the reason why, as Dr. Karzai mentioned, there is many programs, and not on to the global NIH, but as well as different institutions within the NIH. I think one of the things that we mentioned was the United, and basically the goal of this program is to also establish, in terms of enhancing culturally as well as the advanced biomedical research in everything that is in minorities, and also kind of like reduce the barriers as well of all these to racial equity that is affecting overall the whole biomedical research. I think this is I believe a very wonderful program to start, and they have different committees too, and in those different committees you have various about, how can we understand health disparities, so minority health, and how we can improve health equity, also how we can improve and structural racism, and include women's, minorities, and women's overall as well on this, and be more inclusion, and to excel in all those different areas of research, and as well change the policies as well, and the structure to promote diversity. And I think that's also very important. And also the NCI, because Dr. Karzai and I, we are here at the NCI, there is a program which is called the NCI Equity and Inclusion Program. And that's also the goal, to increase diversity in the cancer research workforce too, and also to build a more equitable community within the NCI and address all cancer disparities. And at the same time, one of the things Dr. Karzai mentioned is to kind of like also increase diversity even within the clinical trials in oncology. So I think that's something that it's extremely important, and the NCI is putting a lot of efforts to help with that as well. So I think that these are wonderful programs, I feel like, and it should be models for all institutions out there.